I tend to never.
This meeting is being recorded.
My name is Eric Slaughter. I am a insurance broker. I specialize in Medicare insurance. Just to be clear, I do not work for Medicare or CMS, which is the Center for Medicare and Medicaid Services. The services that I do are 100% free to the public, and I want to thank the Evanston Public Library for allowing me this opportunity to expand the information to the residents of the area. My information is on the screen. It's Eric Slaughter, and my phone number 708-205-8849. Actually, that is my direct cell number. So if you get me, you get me. If you don't, please leave a message, and I'll be happy to return your phone call. If you have any questions that are not answered or some questions that are more detailed and personal of nature, please send me an email. My email address is listed. It is erics@siregroup.com. And just a small ploy, if you haven't figured it out, Sire Group is Eric spelled backwards. That is always a fun fact for a lot of folks. The information that I will be going through is educational information. I'm actually using slides from United Healthcare, but again, it is educational. So it works the same regardless of the company that is presented. Again, very basic information. I won't be going into specific types of plans as far as cost and things of that nature. However, if you do ask a question that I can answer, I'll be happy to do so. At the end, if we have enough time, I will also answer any questions that you have as well. This presentation, I'm going to try to keep to about 45 minutes or so. If I'm typically doing this in person, it takes about 2 hours. So again, we'll be skipping through a lot of things, but hopefully we'll get the gist of how Medicare works. Because there are only a few folks on, if you have a question that is, again, general in nature as I go through this, please go ahead and ask that question. And again, if it's more detailed, please send me an email. So with that, I'll go ahead and get started. Medicare. What is Medicare? A lot of folks think, and again, we're just going to have a conversation, by the way. A lot of folks think that Medicare is just for folks that are over 65 or 66 or perhaps retired. Medicare is actually, yes, it is that, but it also is for folks that have a disability or qualifying Medicare or medical conditions. It is individualized insurance. So a lot of folks are accustomed to group plans or family plans or things of that nature when they're under 65. Medicare is actually individualized. So when you turn 65 and go on to Medicare for the first time, it is your specific plan as opposed to your spouse's specific plan. And that is, again, based on individuals' conditions and in some cases age. So with that, you also need to be need to live in the United States for at least 5 years, including the most recent 5 years before applying for Medicare. A lot of folks think you have to be 65. That is true. However, if there is a Medicare disability, and some of the Medicare disabilities are things like a loss of a limb or both limbs, loss of eyesight, perhaps fibromyalgia or end-stage renal disease, things of that nature that will give you the ability when you are under 65 to actually have the red, white, and blue Medicare card. For those folks that are on Medicare or soon to be on Medicare, the way that you want to go about applying for Medicare is a couple of different ways. One, you can, if you're comfortable going online, I'll put it that way. If you're comfortable going online, you can go to ssa.gov. That is the Social Security Administration's website, and it has a plethora of information on it. But up in the, I believe it's the upper right corner, you'll see apply for benefits. And you can apply for Social Security benefits, or you can apply for Medicare benefits. So this is the primary site that you go to apply for Medicare benefits. A lot of folks think that Medicare and Social Security is one and the same. They're actually two separate entities. It's just that Social Security actually enrolls you in Medicare Parts A and Medicare Part B, as in boy. So again, typically 65 or under 65. There are some folks that are in their 30s and 40s if you have a Medicare disability, perhaps. Eligibility. When it comes to eligibility, if you have a Medicare disability, as an example, typically you have to apply for that disability, get it awarded, and then 24 months after it's awarded, you actually get your Medicare card. There are some ways that you can get that a little bit faster. Some are legal, others are expedient in regards to total blindness, end-stage renal, things that are paramount at that moment. They will push it through a little bit faster. Medicare is not Medicaid, and there's a lot of confusion with that in the marketplace. Medicare is a national program by the federal government. Medicaid in various states are run by the state. If you have, and some people do, have both Medicare and Medicaid, that is what's called dual eligible. You use both programs, and there are some plans that you can get that coincide all the benefits, so that it's actually a pretty good deal, as a matter of fact. But there may be some limitations on the Medicaid side and where you can use that. So you do want to be certain of your doctors, your specialists, when you have both Medicare and Medicaid. Here's a picture on the screen to the new Medicare card. The old card had a series of your Social Security number. When that was created, the Social Security number was paramount at that point, but now because of security reasons, they've changed it 3 years ago now to a series of 11 digits and numbers. You will see on most Medicare cards, you will have Hospital Part A and Medical Part B. Most folks, it will have the exact same date. And also know that Medicare goes month to month on the 1st. So you won't see a date like the 15th, the 13th, the 28th. It will always be the 1st of whatever month that may be. If you happen to see someone or you yourself have a Medicare card with 2 separate dates, that's typically for a couple of different reasons. Reason number 1, you had what's called credible coverage. Credible coverage is an interesting word, and you might want to write that down for those of you that are still working past 65. It's called credible coverage, and what they're looking for is they want to make sure from the time you turn 65 until the time that you originally, or pardon me, to the time that you got your Medicare card, did you have credible coverage or coverage as good as what's available through Medicare? And typically that is coverage through an employer, a group, or a union, or you may be covered by under a spousal plan. In many cases, with that being the case, you do not need to have Medicare Part B as in boy, unless the employer coverage that you have, they have less than 25 employees or 20 employees, pardon me. If that is the case, or you're a sole proprietor or something of that nature, then yes, you will need to also get Medicare Part B. And also along those lines, if you decide to get Part B at a later date, 1 year, 2 years, 5 years later, and during that time, you also had credible coverage through an employer, group, or union, you will not be charged a late enrollment penalty. So be aware of that, because a lot of folks think, well, I didn't get my Part B, I'm going to be charged a late enrollment penalty, even though I still work for the school district. That is not the case. However, they will ask you, they being the insurer or Medicare, for a letter on typically the company's letterhead, or there's a form from Medicare for you to fill out that states that you did have credible coverage from the time you turned 65 through the time you were 67 and then applied for Medicare. So be aware of that, and you will need to hang on to it. A couple of different things then when we look at Medicare. First of all, when you enroll, a lot of folks think that Medicare is of no cost. Well, there is a cost for Medicare, and I'll get into that a little bit later. But typically a person gets Medicare at 65 and or 66 because they have paid into the Medicare system through payroll taxes. Typically 10 years, that will equal your 40 credits to get Medicare Part A at no cost. Medicare Part B, as an example, which I'll go through later, currently has a monthly premium of $170.10. So that's what you'll pay. Typically, if you are receiving Social Security, your Medicare Part B premiums will come out of your Social Security earnings. If you are not receiving Social Security earnings or delayed it, then you'll have to write a check for either every month, 3 months, 6 months, or annually for that Medicare Part B premium. And here's what the options look like, if you will. Option number one is called Original Medicare. That is a person that is turning 65. They go to either in person at the Social Security office and apply, or they apply online through the federal website, ssa.gov. You can apply there. You will get your Medicare Part A, and now they automatically give you Medicare Part B, simply because in the past there was some confusion. It was an option. Now, once you get Part A and Part B and you find that you do not need Part B or don't want Part B, once you get your Medicare card, there is a checkbox that says, I do not want Part B. You send it back in the mail. They'll send you a new card with only Medicare Part A on it. So be aware of that. And again, the reason for that is that there was a lot of confusion. Folks were going 3, 4, 5 years, and no one ever told them that they had to get Part B, and they were wondering why they were being charged a late enrollment penalty. And that's what that LEP is there for. Don't get a LEP, or late enrollment penalty. If you do get a late enrollment penalty, either for Medicare Part A, Part B, or Part D, as in David, those late enrollment penalties will last the rest of your life that you have those plans. But there are ways to avoid it as well, and that's doing the right thing right up front. And I'm happy that you guys are online here. You can start out with just Medicare Part A and Part B and nothing else, but keep in mind that you'll be responsible for all additional costs and co-pays, as well as deductibles. You can also add what's called a Medicare Supplement. Some people call it a Medigap policy. It bridges the gap between what Medicare pays and what has to come out of your pocket. And there's there are variations of Medigap or Medicare Supplement policies that you can get. So you will have an additional policy for your Medicare Supplement plan that you will pay monthly. And keep in mind, all Medicare Supplement policies are insurance policies, not medical policies. So keep that in mind. It's an insurance policy, just like your homeowners, your auto, your microwave, and your television. And you pay that insurance company a monthly premium for that Medicare Supplement. And it will vary widely from one company to the next and one state to the next. So if you're looking at retiring and moving to Arizona or Florida or Texas or something like that, you do want to take a look at your cost for the Medicare Supplement plans. Because Medicare supplements are not a part of Medicare, you then should go out and get a Medicare Part D, as in David, policy, which is your prescription drug plan. And again, Medicare Part D is a part of Medicare, but it is a separate cost for that. So in that realm, option one, you'll have your cost for Medicare Part B, you'll have your cost for the Medicare Supplement, and then you'll have your cost for the prescription drug plan, each on a monthly basis. Option number two, which is becoming more and more valuable actually, is a Medicare Advantage plan. I operate in 18 states, so sometimes they call it Medicare Advantage, sometimes they call it Medicare Part C. Medicare Advantage plans, all of them, actually are a part of Medicare policies and plans itself. There are 4 parts to Medicare. Part A and B, which comes on your red, white, and blue card, and that comes directly from Medicare. Part C, which is a Medicare Advantage, and Part D are your ancillaries, if you will, but they are also a part of Medicare. So again, there are only 4 parts to Medicare. Everything else that you may see is a Medicare Supplement, and those are plans. So it's kind of a play on words. Parts, P-A-R-T-S, of Medicare, and plans of Medicare Supplements. Those are Medicare Supplement plans, and those are your Plan G, Plan N, Plan F, Plan M, Plan C, all of those. We call them alphabet soup because they tend to confuse more people than anything else. But if you do decide to get a Medicare Advantage plan, there are multitudes of those plans that offer additional benefits above and beyond what original Medicare has to offer. Usually, in most cases, your Medicare Part C or Medicare Advantage plans will automatically include your Part D, which is your prescription drug plan, typically at no additional cost. And most of them will also offer additional benefits, such as original Medicare, again, Part A and Part B only, does not cover dental, vision, or hearing. And I find that kind of an odd thing because most of the folks that I deal with are of the age that they need one of those or all three. So again, Medicare, original Medicare does not cover dental, vision, or hearing. But many of the Medicare Advantage plans will offer some savings or all coverage for those three policies or plans themselves. I'm going to skip through the quick tips here. Timing, we're going to go through that. Let's take a deeper dive into Medicare Part A and what it covers. Again, Medicare Part A covers your hospital stays and or inpatient services. It covers a semi-private room, your hospital meals, skilled nursing services. And this is typically, when we talk about skilled nursing, a lot of folks get it confused with long-term care. Let's define both. Skilled nursing is typically, I had a knee replacement, I had it in the hospital or in a ambulatory facility, and maybe there were some complications, or maybe I didn't have someone with me to take me home, and they put me in a skilled nursing facility. Maybe I had some additional issues, and I needed to stay in a skilled nursing facility for the next 2 weeks to recover from my knee replacement or shoulder replacement or something of that nature. So that is an example of a skilled nursing facility. It's temporary. As opposed to long-term care, Medicare does not cover long-term care. Typically, a person will have to go out and get a long-term care policy, which, I mean, there are companies that do that as well. So just a little bit about the differences. Part A will also cover some of your medications and supplies while you're in the hospital, lab tests, things of that nature. I've highlighted the first 3 pints of blood. Part A, or original Medicare, covers some blood transfusions. It actually covers just the first 3 pints. So if you do not have a Medicare Advantage plan or a Medicare Supplement policy and need more than 3 pints of blood, guess what? It's coming out of your pocket for that additional cost for the blood. Down here, I've got a highlighted note that you cannot be denied Part A coverage. There's a couple of different ways that happens. If you've paid into the Medicare system and you do have your 40 credits, you are automatically allowed to apply for Medicare Part A. And in many cases, it just automatically comes to you. Some folks, depending on where they've worked or how many credits they have, they will have to apply themselves. Many of my clients say, well, the card just showed up in the mail and I never did anything. That's quite common. About 70% of the time, that's what's going to happen. But if you're past your 65th birthday and maybe you're approaching your 66th birthday and you don't have your Medicare card, I would strongly encourage you to apply. And as a matter of fact, I strongly encourage anyone to apply typically 3 months before they turn 65 so that we know that everything is in place. Some of the things that cause hiccups, if you will, is we see that birth dates are incorrect, Social Security numbers perhaps are incorrect, or maybe they have your zip codes incorrect. So these are a couple of things right off the cuff that will delay your getting your Medicare Part A and Part B. And as I'm talking about that, I also want to make sure that folks realize if you do not have enough credits for Medicare Part A at no cost, again, there is a cost for it. And guess what? I'm coming up to it. Part A costs you absolutely nothing if you have the 4 credits. There is a 0 monthly premium. However, if you have not paid into the Medicare system at all, it can be as high as $499 a month that you will be charged just for Medicare Part A. And a lot of times we see this because a person has paid into their own systems, if you will. A lot of teachers, a lot of state and some local employees, police officers, firemen, as an example, may pay into something different, or higher education folks will pay into SARS or something of that nature that will offset that. So be aware if you qualify for Part A at no cost, because again, if you have 0 credits, you're going to pay $499 or as much as. If you have less than 38 credits, then it's prorated. And many times you'll see people over 65 that will continue to work or get perhaps a part-time job because they need 3, 4, 7, 8 credits to get their Medicare Part A at no cost. And as you can see, at $499 a month, and then you retire, that can be a deep dive into your pocket. Copays. There is no copay for a hospital stay that is 60 days or less when it comes to Medicare Part A. 60 days with Medicare is considered a benefit period. So Medicare Part A has a deductible per benefit period. And this is one of the reasons that folks, many of them, will go out and get additional policies, whether it be a Medicare Supplement plan or a Medicare Advantage plan, so that they can avoid perhaps some of the copays or deductibles. And as you can see, for Medicare Part A, for one benefit period, the deductible is $1,556. And this changes on an annual basis, by the way. So each year, Medicare sends out what's called the Medicare and You Guide, and it will let you know exactly what the deductibles are for each upcoming year. It typically comes out late September, early October to each person that has Medicare. They are cutting back, so maybe there's a checkbox that says, I want to receive the booklet, or you can download it online. So they're trying to push more and more online. And as you can see, once the benefit days are over, you're at $389 per day after days 61. If you have more days than that, you have what's called a lifetime reserve days. And at that point, your hospital stay per day is $778 for days after that. There is also what's called a late enrollment penalty. The late enrollment penalty is 10% of the premium amount that is charged every month for twice the number of years that you did not enroll in Medicare. So we want to make sure that you enroll upfront, early, in advance, and I strongly advise you to get this stuff done minimum 2 to 3 months in advance, actually. So you'll have your Medicare card sitting at your house before the date is even effective. That's the ideal period that you want. Now let's take a look at Medicare Part B. And I think Medicare Part B is quite honestly more advantageous than Part A in many ways. And the reason I say that, Part B covers all of your ancillaries, if you will. It covers your doctor's visits. It covers your annual checkups. It covers things like including your hospital stays, your wellness visits, skilled nursing, preventative services like flu shots. And let me give you a caveat as well. A lot of folks think it automatically covers not the flu shot, what is it called? Well, it does cover pneumonia, but now I lost my train of thought, sorry. But it covers a lot of things like, again, your x-rays, some transfusions, lab services. So you want to be aware of what Part B covers. It also covers if you're an insomniac, perhaps, or you're just up late at night, you'll see these scooter commercials or walk-in bathtub commercials and things of this nature. Medicare Part B covers some of that, if not all of that, depending on the device itself. It's called durable medical equipment. And what it does is, if your doctor has a script, if you will, for that durable medical equipment because you need a walk-in bathtub, then guess what? Part B is helping to pay for that. And so if you need a handrails or things like a wheelchair ramp, in many cases, Medicare Part B will pay for it. So you want to make sure that, as my grandmother would say, closed mouths don't get fed. You want to make sure that you ask for things that you need, and that comes from your doctor. You want to make sure that your doctor is giving you that durable medical equipment. Also keep in mind, typically there's a 10% or 20% cost to that durable medical equipment, depending on the plan that you have. So you want to be aware of that in most cases. Here's what Medicare Part B looks like as far as cost. Monthly Medicare Part B, if you are having it coming out of your Social Security earnings, which most folks will, I always say out of sight, out of mind. If it comes out of your Social Security earnings, whatever shows up in your checking or savings account, you can go spend it because Medicare is going to take out, in this case, their 170/10 on a monthly basis. If you are, as a sidebar, if you are a person that has both Medicare and Medicaid, which is commonly called dual eligible, if you have dual eligibility at 75% or 100% or some form of that, or you're on the what's called low income subsidy, you may actually get your Medicare Part B premiums returned to you. So instead of taking out the 170/10, they take out nothing. So again, I just want to make you guys aware of that. But it does come out on a monthly basis. Medicare Part B is dependent upon your income. I'm not going to go into detail, but if your income is above, as an individual, $87,000 a year in retirement, then your Medicare Part B premiums are prorated. The highest amount that Medicare will charge you for Medicare Part B, as listed, is $78.30. Typically, these are for folks that are high income earners. And again, Medicare is spreading the joy, if you will, and essentially stating you earn more money and you can afford it. So the premiums will be higher. Also, so that you're aware, based on your income above that dollar amount, Medicare may also charge you additional cost for your Medicare Part D, as in David. So not only are you getting additional cost for your Medicare Part B once you are a high income earner, but also your Part D, your prescription drug plan. And again, it's because we're spreading it so that folks that cannot afford it have the same advantages as folks that can. The deductible is not as bad. It's an annualized deductible versus a per benefit period deductible. So your Medicare Part B, as in boy, has an annual deductible currently of $233. Keep in mind, if you have certain Medicare Supplement policies, and I believe all the Medicare Advantage policies, there are, in most cases, no deductibles for Part A or Medicare Part B. So you get to avoid those. And again, this is one of the reasons that many people will choose an additional plan above and beyond original Medicare. Generally, again, as a footnote here, your co-insurance is 20% of the Medicare approved amount. And that's an interesting word, Medicare approved amount. As an example, when we talk about Medicare approved amount, all procedures, regardless of the plan that you have to be approved by Medicare. If it's not approved by Medicare, then you're going to pay out of pocket for that knee surgery, as an example, because it's a new experimental knee surgery and it's not been approved by Medicare. So in that case, Medicare will deny it and your insurance plan will not pay for it either. But if you really want it, then in that case, you're going to be paying 100% of the cost for that because it's not an approved procedure for Medicare. And typically that is for a new procedure that has just come on the marketplace. When we talk about Medicare Part C, as in Charlie, Medicare Part C is a Medicare Advantage plan. So if you hear Medicare Advantage or Medicare Part C, as in Charlie, it's the same thing. There are variations of Medicare Advantage. There are what's called cost plans. There are special needs plans. These are plans for folks that are may have such as dual eligibility, Medicare and Medicaid. Those are special needs plans. Dual eligible plans, plans for folks that are institutionalized. These are folks that are in a medical institution perhaps, or a long-term care facility perhaps. There are plans for folks that have certain chronic conditions, which are called chronic plans. Maybe it's diabetes or heart disease or end-stage renal, something of that nature. And there are various types of Medicare Advantage plans. You have a HMO, Health Maintenance Organization, and the HMO is traditional, kind of like you need to stay in that box, if you will. So you need to choose a primary doctor, and everything goes through your doctor. Keep in mind, if there is an accident or an emergency anywhere in the United States, all of these plans will cover emergency care. You want to make sure that you go through the emergency room doors, not to a minor care facility. You must use it if you're in Alabama or California or anywhere else. Make sure that you go through the emergency room doors and your plan will cover that emergency. So no issues there. However, if you are on an HMO, you have to stay within the plan's network of providers. Otherwise, outside of an emergency, you're going to pay 100% of that cost. Now, there's also what's called PPOs, Preferred Provider Organizations. This is a broader bandwidth or broader brush, if you will, of the HMO. What it does is it allows you to go to far more facilities, choose more doctors. And as a footnote, I will let you know on a PPO plan, if it's a Medicare Advantage plan, it gives you more options to see specialists. And because I've been doing this over 18 years, as folks age, you're going to need to see more specialists in many cases versus your primary doctor. So in most cases, a PPO is more advantageous than an HMO, depending on your situation. So I wanted to make you aware of that. And that's because more and more specialists will take a PPO versus an HMO. And that's just how the cards are played here at this point, quite frankly. You can also get a regional PPO. So there are variations of those types of plans depending on where you live. Also, if you decide to move to another state, we live close to Indiana, Wisconsin, Iowa, and Michigan. If you decide to move to another state, you will need to change plans for that particular state based on where you live. Medicare is Medicare nationwide. However, once you have a plan, regardless of the company name of those plans, they have various plans depending on the state that you live in, and in some cases, even the zip code that you live in. So you will need to change plans if you decide to move to Peoria or Springfield, or move over to Dyer, Indiana, if you will, or up to Milwaukee. You will need to change your plans, and they will give you a 60-day grace period for that. Again, additional benefits above and beyond original Medicare. The majority of the Medicare Advantage / Medicare Part C plans will automatically include prescription drug plan Part D, as in David, at no additional cost. So again, speaking to that, if you are with a Medicare Supplement policy, then you have a separate Medicare Part D plan that you're paying for on a monthly basis. Many times, if you have a prescription drug plan included with your Medicare Advantage plan, there is no additional cost, so there's a savings. Again, as I stated earlier, Medicare does not cover dental, vision, or hearing. Depending on the Medicare Advantage plan that you have, the majority of them will cover dental, vision, and or hearing. Sidebar to that, Medicare or original Medicare will cover vision if it is due to a eye disease such as glaucoma, or if you have cataract and the cataract surgery, it will cover that as well. But if it's just to have your eyes examined and just to have some eyeglasses or contact lenses, Medicare, original Medicare does not cover that. But again, keep in mind, if you have an ailment, perhaps diabetes as an example, and you're having or needing a diabetic eye exam, Medicare covers that. When it comes to hearing, the only thing that we've seen that Medicare will cover in regards to hearing, other than an accident, would be something like a cochlear implant. And that's, if you've seen folks with what looks like a quarter or silver dollar up to the side rear of their ear with a tube running into it, that is a cochlear implant. So Medicare covers that. But again, nothing else. Many of these Medicare Advantage plans will also cover wellness benefits like gym memberships and additional things that Medicare does not cover that you may be very well interested in. And it works fairly well when it comes to that. Cost. When it comes to Medicare Advantage plans, they vary widely. There are many Medicare Advantage plans that have, as you will see on television and things of this nature, a 0 monthly premium, which is often advantageous for a lot of folks. But with that, you will still have what's called co-pays and co-insurance when you actually use it. The other thing that you want to take a look at, because we'll use Chicagoland as an example, there's a myriad of Medicare Advantage plans. So a person may say, well, what's the difference between one versus the other? Option number one, you really want to make sure that that Medicare Advantage plan covers your primary doctor that you're currently seeing if you want to keep that doctor. You also want to make sure that that Medicare Advantage plan covers your specialist, as long as you want to keep those specialists. You have options of changing, but again, if you want to keep those your primary doctor or PCP as well as your specialist, first point to make would be to make sure that that plan covers those doctors. And the facility that you visit the most, whether it's Northwestern or Loyola or Gottlieb or University of Chicago or whichever hospital you prefer to go to, you want to make sure that those facilities are in network with whatever plan that you have. The other thing that you want to look at is called the maximum out-of-pocket, and that's not a deductible, but what it is Medicare sets standards on an annual basis from January 1 to December 31 that says, based on the Medicare Advantage plan that you have, the most that we can get out of your pocket for all of your ailments or hospital stays or costs is this dollar amount over an annualized period. In most cases, for 2022, the maximum out of pocket is $7,550. I can tell you that there are some that are far less than that. So again, if you want to compare one to the next, that may be something that you want to take a look at. I've already talked about the 6 different types of Medicare Advantage plans. Here they are on your screen. So if you want to take a quick look at that, again, I've already spoken to that as well. And then we're going to talk about Medicare Part D. And again, 4 parts to Medicare. Part A, Part B, Part C, and then finally Part D are the only parts to Medicare, which cannot be denied. Prescription drug plans, if you get it separately with a Medicare, original Medicare Part A and B, or you get it with a Medicare Supplement policy, there is a monthly premium based on what your needs are. And those monthly premiums will vary widely. I will encourage you, based on your prescriptions, to really investigate the prescription drug plan because they are not all the same. The drug plans cost are not all the same, and the costs for the medications from plan to plan are different, as well as the prescriptions or copays that you have when you pick the medications up at the pharmacy. So many people will ask, well, here's one for a low dollar amount versus one for a high dollar amount. What's the difference? Well, quite frankly, the difference is cost and what you pay, but the real difference is your prescriptions covered, and is the potential prescription that you may need in the future going to be covered? Typically, what we see the biggest differences are between the low-cost plans and the high-cost plans is the amount of prescriptions that are covered. So if you have a high-end prescription, chances are you're wanting to be covered by a higher end prescription drug plan. The lower cost plan may not work for you, and the reason for that is it may not be covered, that particular drug, or it may be covered but with a higher out of cost or copay than what you may want to pay. So just wanted to give you an overview of that. Again, even if you have a Medicare Part C plan or Medicare Advantage plan, if you are a veteran, as an example, you may not need it. So there are plans that exclude the Part D portion of the Medicare Advantage plan. Or if you are a veteran with veterans benefits and you use the VA for your prescriptions, and you have a separate prescription drug plan along with your Medicare supplement policy, again, an insurance policy, you may not need the prescription drug plan. So those are a couple of ways that you can avoid many times the additional cost. Keep in mind, again, when it comes to cost, it varies widely. In 2022, the annual deductible for most plans that have a separate prescription drug plan is $400 or up to $480 a year. The majority of the Medicare Advantage policies do not have an annual deductible. Again, I'll repeat that. If you have original Medicare only and then a Part D policy, or if you have original Medicare along with a Medicare Supplement and then a Medicare Part D or prescription drug plan, depending on the plan that you have, you may have an annual deductible up to $480. Let's take a look at what that truly may look like. As an example, if you have what's called a tier 1 drug, which is the lowest cost generic drug, and it may be $2 or $10 for you to pick up that prescription, and you have a $480 annual deductible, what that means is January 1, before that prescription cost of $2, $5, $8, or $10, you will have to pay that deductible, $480, before the prescription price of $2 or maybe up to $10 for that low cost prescription will kick in. So be aware of that, because many times people have argued, well, my deductible is $480 and I take 2 prescriptions that are $2 a piece. So you might want to take a look at some of those things. Other things that folks are confused about, commonly called the donut hole, and many agents really don't know how to explain this well, but here it is. Here's the Reader's Digest version of it, if you will, but quite honestly, here's what it looks like. If you have a separate prescription drug plan and you have an annual deductible, you have to meet your annual deductible first. If you have a Medicare Advantage plan and there is no annual deductible, then you automatically start in the initial coverage stage. And you are paying your prescriptions as you pick them up at your local pharmacy, whether it is $2 or $50 or whatever the case may be. You're in the initial coverage stage. In that initial coverage stage, as you pay for your prescriptions, what all Medicare Part D organizations look at, and here's the gist, we look at the retail price of the drug, not the price that you pay when you pick it up at the pharmacy. So this is the biggest confusion. As an example, if the drug that you're picking up retails for $480, although you pick it up and pay the pharmacist $10, most people will think, my prescription cost me $10. Your prescription actually, and what we're all using, is that $480 mark. So keeping that in mind, the retail price, not the price that you pay at the pharmacy. So what we look at is you're in the initial coverage phase until all of the cost of your drugs in that 1 year reach $4,431. Under that dollar amount, you're in the initial coverage phase. Once you go back to the pharmacy and you've exceeded that, you fall into what's called the donut hole, which is pretty common actually. The real term is called the coverage gap. Between $4,430 and $7,051 or $50, if you will, you're in the donut hole. When you are in the donut hole, and again, keeping in mind, we are using the retail price of the drug. When all of your drugs has reached or exceeded $44.31, when you're in the donut hole, you will pay 25% for the cost of the brand name and generic drug that you're taking. So that $480, you're going to pay 25% of that. So the next time you go to the pharmacy, instead of paying $10, you're going to pay 25% of $480 until the end of the year or until you exit the donut hole. Now, the last phase is called catastrophic. That is when you have exited the donut hole within that year at $7,051 and beyond, you pay a small copay or a coinsurance amount. And it varies, but typically it's anywhere from $3.95 for the lowest cost up to $8.50 until the end of the year. And then January 1, it starts all over again. The only way to decrease your options of getting into the donut hole is consult your doctor and see if there's another medication that you can take that does the same thing. It may be what's called step therapy, which means you go from one drug to the next to see what works, or you go back to your doctor and say, hey, doc, this particular drug is burning a hole in my pocket and I'm falling into the donut hole every single year. Is there another drug that I can take that does the same thing without any adverse reactions? Typically, the answer is yes, if you're on most of the common drugs, and they will change the drug. And that is really the only option that you have to not get into the donut hole. Because again, we're looking at the retail price of the drug, regardless of the company that you go to, they are all the same. I did talk about the penalty for not enrolling in Medicare Part D. It is, the numbers work out to 1% per month for every month you went without having your prescription drug plan up until the point that you actually get it. And if you want to look at it in this light, it's 12% per year that you go without it. And we've seen people go 3, 4, and 5 years without a prescription drug plan. And people will say, well, no one ever told me. Or 2, I jog 3 miles a day. I'm in perfect health. I take an aspirin when I get a headache. I didn't see the need to add the additional costs, and Eric understands that. However, choose a plan that automatically includes it, because if you do not, Medicare, when you do get sick and need, whether it's 3 years, 5 years, or 10 years down the road, Medicare is going to go all the way back to when you turned 65 and or was eligible for Medicare Part D, and they're going to charge you a late enrollment penalty that's going to last the rest of your life based on how many months you went without having your prescription drug plan. And I know that was a lot, so I apologize in advance. When it comes to Medigap policies or Medicare Supplement policies, again, you must have Medicare Part A and Part B in order to get it. There are varied costs from one company to the next. Many people will ask, well, Eric, what's the difference between a Medicare Supplement Plan G from Company A versus Company B? Quite honestly, it's cost. They can set the cost at whatever they want. And for the state of Illinois, along with most other states, we are considered what's called age-in plans or policies. What that means is that every year that you increase in age, or in some cases every other year, that policy will increase in price because they're taking bigger risk as you age. So when you start out at age 65, maybe not so bad. When you're pushing 75, it's taking a bigger bite out of your pocket. And most folks don't think about that until it happens. But I always want to make sure that they understand that typically your income goes down by 1/3 or 2/3 once you retire. So you're living on a fixed income, and some of these costs will increase. So you want to be aware of that. And most Medicare supplement policies will not pay, or only pay a small portion of what's called Medicare excess charges. Excess charges are what the doctors and facilities can charge if they go above and beyond, up to 15%. And that will come right out of your pocket. The supplement policy, for the most part, and the plan will not pay for that. I'm going to skip through this because I'm running a little short on time. I've got about 7 minutes left. So times that you can change your coverage. Number 1, when you first turn 65, you have, for Medicare supplement policies, you have the first 6 months before your 61st or 65th birthday month to actually enroll in a Medicare supplement policy. If you are going to enroll in a Medicare Advantage policy, you have a 7-month period of time. That 7-month is the 3 months before your birthday month, the month of your 65th birth date, and then 3 months after that. So you have a complete 7-month period of time in which to enroll in a Medicare Advantage or prescription drug plan, and you will not be denied. Because these are Medicare policies and not insurance policies, there is no denial or coverage that you will be denied based on pre-existing conditions. So in a nutshell, no matter what is wrong with you, medically, you will not be denied for any of these policies. Now, when it comes to your Part D, as in David, prescription drug plan, and your Part C, the Medicare Advantage policies, once you get into those policies, each year you will have what's called the annual enrollment period. The annual enrollment period is from October 15th through December 7th. And what it does is it gives you the option to make changes if you so desire. If you like the plan that you have, there's no one that you need to call. There's nothing that you need to do. There's no signature or signage that you need to take care of. It will automatically renew itself each and every year. So don't be swayed, as long as you like your plan. Again, don't be swayed by commercials or people calling you or things in the mail saying you need to change your plan. As long as you like it, there's nothing that you need to do. So understand that. There's also what's called the open enrollment period, and that's a little confusing for a lot of folks. It started about 3 years ago. The open enrollment period happens if you are in a Medicare Advantage plan, specifically from January 1 through March 31, and it gives you the opportunity to go, oops, I made a mistake. I changed my plan in October or November, and I shouldn't have changed it. So it gives you the opportunity to go back to what you had or choose a different one, or same thing with your prescription drug plan. Once that has ceased, you're in that plan until the end of the year, unless you have what's called a qualifying life event, which is I've moved out of the state or out of my service area, or I've gotten an ailment, diabetes, heart disease, something of that nature, and a special needs plan may be better for me, so you can switch. Or if you are a dual eligible customer, both Medicare and Medicaid, you have the option essentially 3 times a year, quarterly, to make changes to that plan if you so desire. And then the last quarter is the annual enrollment period, which the new plan will start January 1. So I am going to stop there because it gets a little busy after this, and I'm going to open it up to any questions that you guys have. Just unmute yourself, and I will take questions at this point. Again, I'm going to leave my phone number and email address on the screen. So if you have additional questions or curiosity about something, again, there is no charge for anything that I do. The best option, in my opinion, would be to shoot me an email and I will respond in kind. So again, I will open it up now to anyone that has a question. Just unmute yourself, and let's hopefully it's all general questions. So go right ahead. Wow, no questions. Okay, well, I either did a really, really good job or I confused the heck out of everybody. Again, I'm going to leave it open for questions here for a little bit more time. And if you don't have any questions, but it's a little bit more detailed in nature, feel free to shoot me an email. I will respond to that. My email address is erics@siregroup.com, and that's spelled CIREGROUP.com. I'll give you guys another moment if you come up with any questions. Other than that, I really appreciate your time. And Irene, I appreciate your time with the Evanston Library. Thank you very much. This goes on monthly, and also during the last quarter of the year, during the annual enrollment, we will be doing it twice a month for folks because they have, it's a heightened nature during that time of the year. Thank you guys very, very much. And again, Irene, thank you very much. Any parting words by chance?
You all take care.
Okay. Thank you very much. You guys have a wonderful afternoon and day, and I appreciate your time. Have a great day.